In our case today, just admitted now, full-term baby, 38 weeks. During the clinical examination, we discovered the baby had a scaphoid abdomen with chest bulging. So we request X-ray, is confirmed congenital diaphragmtic hernia. We request a blood gas, solid respiratory acidosis, and we put him in conventional mechanical ventilation, but unfortunately the baby still desaturated and cannot maintain saturation with respiratory acidosis. So we decided to shift him from conventional mechanical ventilation to high frequency. So Mr. Anas, our senior respiratory therapist, he will tell us how to apply the high frequency. Mr. Anas, please.
First of all, what is high frequency ventilation? High frequency ventilation basically is CPAP plus wiggling. And when do we use the high frequency ventilation? When the patient is having respiratory failure with the blood gas showing severe acidosis, pH around 7.1, CO2 around 90s. Then after that you can apply the high frequency ventilation mode. You can go to the screen. Then to the right corner, it shows the ventilator settings. You press to the ventilator settings, it will show the ventilator modes, the conventional modes, which we won't be discussing. We will discuss the other modes, which is you can go here, then put the high frequency ventilation to the second row. After that, it will show 5 parameters. One is fixed, which is the IA ratio, 1 to 2 for all patients. The other four parameters, 2 of them is for ventilation, and the other 2 is for oxygenation. The ventilation side is the frequency and the amplitude. You can adjust the frequency by initially starting with 10. Then after that, after the blood gas, you can adjust it, but it will be the vice versa to the conventional mode. If the blood gas is acidosis, you will decrease the rate, the frequency, not increase it. Then you will see the amplitude, which you will adjust it by seeing the wiggling on the patient. And here we finish the ventilation side. After that, you'll go to the oxygenation side, which is the FI2. Depend on the saturation of the patient, you will increase it or decrease it. And the MAP, which is depend on the minutes ventilation, you will increase or decrease depend on it by 2 to 0.5. And after the chest X-ray, if it shows hyperinflation, you will go down with the MAP. And eventually, if the patient did not improve with high settings, also with high FI2, you will go with the nitric oxide option. And that's it for the high frequency ventilation.
Thank you, Mr. Anas, and thank you for everybody.